There is a strong relationship between people and their dogs. It is a bond that is rooted in shared experiences. Canine-assisted therapy is a growing field that utilizes our four-legged friends to help us heal and cope with a variety of physical and mental health issues. This article outlines the future of this human-canine connection and explores the challenges and opportunities it presents for researchers. Research methods. Dogs are excellent at solving complicated visual tasks and have a decent sense of object permanence. They also are great at discriminating between different expressions of emotion. While this is an impressive feat, it is not yet well understood. Despite the advances made in identifying dog cognition, many of its capacities remain untapped. In the quest for a better understanding, researchers have looked at a variety of methods. Some focus on the health and happiness benefits of dogs. Others explore the complex relationship between humans and canines. For instance, the oxytocin boosts the bond between animals and their humans. Animals are also adept at recognizing individual humans and even at identifying human faces. Similarly, they have the ability to use non-invasive neuroimaging techniques to examine their own brains. While the most common approach to animal research involves examining the behaviors of dogs, there are ways to enhance these efforts by using all aspects of the animal's life. Among the techniques used are social learning and classical conditioning. A more complex approach would incorporate all of these elements into a single, cohesive system. Such a strategy would increase the quality of future research, while reducing the risk of weak inferences from the most important findings. Ultimately, a holistic approach to enhancing canine performance would be the most productive way to maximize the unique abilities of the species. It also offers the best possible match to the individual needs of the canine. The benefits of this method include the ability to develop desirable behaviors in dogs' early stages of development. Furthermore, the method also helps reduce communicative errors due to peripheral vision. This is especially true for the domestic canine. Canine-human bond. The human-canine bond is an intense, mutually beneficial relationship. This dynamic relationship is characterized by a range of physical and psychological interactions. It is also influenced by behaviors that are essential for health. For instance, a study found that dogs exhibit signs of affection when we pet them. In addition, oxytocin, a hormone that is associated with bonding, is released when we pet a dog. Another study examined how the presence of a canine can enhance a search and rescue mission. Results showed that canines were more likely to respond to a call when they knew their human companion had arrived home safely. The best part about the study is that it provided important information to trainers, handlers, and first responders. Likewise, it also helped set the stage for further research. The Wallace-Annenberg Pet Space Leadership Institute published 2 papers in the Frontiers in Veterinary Science. One of these, The Health and Well-Being of Canines in Human Hospitals, focuses on canine-human interaction in healthcare settings. The other, The Human-Animal Bond, a Key to the Future of Veterinary Medicine, demonstrates how the veterinary profession can fulfill human and animal needs. One of the most popular ways to enhance the human-canine bond is by training a dog to perform tasks. Teaching a dog to retrieve or find hidden objects can improve this relationship. The Wallace-Annenberg Pet Space is a unique community space dedicated to pets. It features an educational center and a place for adoptions. Moreover, it also supports projects around the world. Among the many innovations of the Wallace-Annenberg Pet Space is its interactive dog adoption portal. By providing a platform for pet adoption, the non-profit organization hopes to expand its reach and increase the number of pet adoptions. Aging of humans and dogs. There have been several studies that have explored the aging of humans and dogs. These have highlighted the similarities between the two species. Researchers have studied methylation patterns to assess the age of dogs and humans. Methylation marks are wrinkles on the genome that change with age. Scientists have found that these changes occur in predictable ways. They are also known as methylation clocks. This study was carried out by researchers from the University of California, Davis, and the University of Pittsburgh School of Medicine. A group of 320 people were examined for their methylation patterns. Their methylation patterns were compared with those of 320 people of the same age. The study findings showed that aging of humans and dogs has similar physiological and behavioral changes. However, these phenotype alterations are not entirely overlapping. Rather, the musculoskeletal, urinary, and reproductive systems exhibited the most pathological changes. It was also reported that cardiovascular disease occurred in males at a higher rate than females. In addition, older humans were found to have an increased risk of cancer. In recent years, dogs have also experienced a rise in longevity. Some breeds have lifespans as high as 70 years, while others have a lifespan of just a few years. In addition to these increases in longevity, pets also undergo physical and behavioral changes. Pets are also prone to diseases like cancer. Currently, cancer is the leading cause of death for pet dogs and cats. One study, published in Aging and Cancer in March, compared the aging of canines with human aging. The researchers used a formula to determine the equivalent ages. As a result, the ratio of dog to human aging was found to vary over time. Initially, the adage 1 dog year equals 7 human years was used. But the equation is now more complex and provides more reasonable estimates of equivalent ages. Canine-assisted therapy. Canine-assisted interventions, CAI, are increasing in use in healthcare settings. The relationship between human and animal provides benefits both physically and emotionally, and may help ground patients. However, CAI programs need to be evaluated for efficacy and safety. This paper describes the challenges involved in establishing and maintaining safe and effective programs. It also provides a model best practice program to guide hospitals. Typically, dog handlers spend a great deal of time and energy in training, testing, and registering with a therapy dog organization. But these programs often lack standardized policies and procedures to ensure the welfare of the therapy animal and the health of the patient. In addition, there are many practical issues that need to be considered, such as how to protect the safety of the dog and its owner. As the use of CAI grows in hospitals, hospitals need to develop comprehensive, informed policies that minimize the risks to both humans and animals. For example, dogs must be well-fed and free of parasites. They must also be trained to be calm and comfortable in the presence of people. CAI has become a popular option in a variety of settings, but a lack of evidence has led to safety concerns. Therefore, more studies are needed to assess the effectiveness of CAI for hospitalized patients. In order to determine whether CAI can be safely used in hospital settings, a study conducted by the Wallace-Annenberg Pet Space Leadership Institute explored a variety of issues. They found that patients with mood disorders had reduced state anxiety after a routine therapeutic recreation session. Similarly, patients with psychotic disorders had reduced anxiety after participating in an animal-as therapy session. While both types of sessions were associated with reduced anxiety scores, only animal-as therapy resulted in a higher reduction in anxiety. Future challenges and opportunities. The Wallace-Annenberg Pet Space Leadership Institute recently published 2 papers aimed at the burgeoning canine and human healthcare arena. These studies are the byproduct of a multi-pronged effort to understand the interactions between dogs and humans in the context of their kin and the community at large. A third paper will be released later in the year. In addition to a few other papers in the works, the Institute is also putting its hat in the doghouse. Its mission is to provide research, education, and training to advance the health and welfare of dogs and their humans. Specifically, this is achieved by enhancing the quality and effectiveness of canine clinical trials by identifying, developing, and evaluating new treatment technologies. Some of the Institute's more notable work has been in the development of standardized best practices for hospital therapy dogs. This is the mainstay of its animal care and health management program, as well as the primary driver of the organization's mission to promote and implement improvements in the health, well-being, and quality of life of dogs and their humans. Although it isn't possible to comprehensively assess the potential for canine clinical trials to deliver new and better therapies, the Institute's ongoing research has already yielded a number of significant results. One of the most impressive is the ability to identify and evaluate new treatments for the treatment of canine otitis.